Nixon, Lenin, Reagan, Ali. These people were once very famous, though they were hit by paralysis. Perhaps their lives were ended by this disease, or they are spending the rest of their lives disabled. It is common for people to live and spend their lives without any pain. However, once being attacked by paralysis, you'll have to throw away this hope. While paralysis is difficult to cure, it is common for it to reoccur, even if it had been cured. Hence, the hope to live a long, healthy life through a cure is ever continuing. How does Korean traditional medicine produce effects through paralysis treatment and go about treating this disease? Paralysis patients are the most common patients of Korean traditional medicine. In Korea, a large number of these patients prefer to take Korean traditional treatment for paralysis. 73-year-old Mrs. Ju is one of them.
조금씩 더 나아지실 거예요. 앞으로 한 열흘간은 좀 조심하셔야 돼요, 더.
Mrs. Ju's left arm and leg were paralyzed when she collapsed 10 days ago. Her blood pressure was usually high, and although she had symptoms such as not being able to speak normally, she hadn't paid much attention. Mrs. Ju's skin color is rather white compared to others. This is a symptom of weak overall vital energy. Mrs. Ju was able to prevent serious consequences since she was taken to the hospital for an emergency. She is currently receiving acupuncture treatment consistently for her paralysis. Furthermore, the application of moxibustion on the abdomen has helped her to recoup the vital energy in her weakened body. Continuous moxibustion and acupuncture treatment has brought about significant effects.
저런 백남 쓰러진다고 무조건 쓰러지면 아무것도 모르고 깜빡해 버려. 오면은 이 배우는 이비인후과가 있는 거야. 지금은 참 좋지요. 이제 머리가 이제 쫓고 왔다 싶어도 그도 올 때 진짜 복도 나가서 얼썩거리고 놀고 그랬어요. 참 좋아요.
Although she has symptoms of paralysis from frequent cramps in her left arm and leg, and as she had lost all her vital energy, she has now improved enough to be able to move with some assistance. So how has Korean traditional medicine perceived paralysis as a result of sudden collapse and paralyzation? The development of civilization has enriched the lives of human beings. This, together with continuous advancement in biotechnology, has extended life expectancy uncomparable to the past. People's interest in health has grown just as keen as their life expectancy has grown long. Sudden attacks of paralysis have long been the problem of human beings. It remains as homework to be solved as we get older.
한의학적으로 중풍은 풍에 맞았다고 하는 겁니다. 그래서 풍의 성질은 잘 움직이는 성질이거든요. 근데 한의학적으로 풍이 자연계에 잘 움직이는 성질이 몸에 와서 맞으면은 이 성질이 바꿔져서요, 움직이지 못한다든가 저린다든가 그런 증상을 나타낼 게 중풍이라고 합니다. 그래서 대표적으로 사지가 못 쓴다든가 아니면 편마입이라고 그래서 이 좌측이나 우측 한쪽만 마비되는 경우가 있고요. 심해지면 말을 못하다든가 의식이 불명돼서 생명의 위협까지 나타나는 증상을 한의학적으로 말합니다.
Generally, paralysis is a disease that occurs as a result of various reasons. For instance, blocked or breaking out of blood vessels, or the brain has lost part of its function. Considering the function of the brain, which controls various functions of our body, it is no doubt a serious disorder. In chronic cases, it even causes death, and even if life has been saved, patients may have to live forever with disability. The causes of paralysis are high blood pressure and arteriosclerosis, arteriosclerosis type of heart disease, hyperlipemia, diabetes, smoking, and irregular pulse, as well as genetic factors. Smoking especially is a dangerous factor that increases the chance of attack up to 3 or 4 times. Symptoms of paralysis that occur as a result of cerebrovascular circulation disorder will vary depending on the injured area. In general, paralysis of half of the body is taken as the main symptom, followed by oral disorder, dementia, bowel movement disorder, and even in swallowing of food. According to the World Statistics of Health Organization, paralysis has taken the lives of 5,500,000 people all over the world and ranks second as a cause of death. If this is the trend, it appears that deaths may reach over 7 million by the year 2020. In Korea's case, paralysis has become the top cause of death. Within 1 year in the survey, the number of paralysis patients reached 113,000, with 33,000 deaths. It is a chronic disease that takes 1 out of every 3 of these patients' lives. Tongyi Pogam is the representative Korean traditional medicine document. This book contains detailed records of paralysis. According to this book, paralysis is a disease that occurs by receiving negative vital energy, causing symptoms of sudden unconsciousness and hemiplegia. According to this book, the causes of paralysis are heat, wind, and phlegm, which cause internal negative vital energy, mental depression, and fluid retention.
바람에는 사람 몸에 밖에서 들어오는 내풍과 안에서 일어나는 내풍이 있는데 보통 중풍은 내풍에 의해서 발생한 질환을 얘기합니다. 내풍이 일어나는 원인은 몸에 있는 화가 그 원인인데 화로 인해서 바람이 일고 바람에 의해서 몸의 균형이 깨뜨려지는 거죠.
For paralysis, the patient's status must be analyzed before going into treatment. Firstly, the internal balance is checked by using a vital energy function tester. Responses occur when the machine is put on the special acupuncture points of the meridian that are linked to the organs. Depending on the level of response, we could determine the condition of organs that are related to special acupuncture points. Stress, which used to be called a mental disorder, especially in the past. How much stress is affecting the function of organs can be determined through the test. It is easy to be attacked by paralysis if the blood is not clear. This is one of the reasons why those suffering from hyperlipemia, which occurs due to high cholesterol in the blood, have a higher chance of contracting paralysis. The level of individual cholesterol and fats will be determined through the blood test. Those paralysis patients suffering as a result of hyperlipemia have unclear blood, which tends to be sticky. Through this test, we can find out how the unclear blood in blood vessels makes waste products and blocks cerebrovascular circulation. The cerebrovascular flow test, which tests blood that flows through the cerebrovascular, is the most important paralysis test. Brain cells that once received blood through the arteries shall die out once cerebral artery contracts. Hence, the condition of the cerebral artery will need to be tested through the cerebrovascular flow test before the treatment takes place. The vital standing resonance function test divides the body into 7 parts and tests the function of organs and energy. The body, with electricity lines, is stimulated by frequency. At what point to give treatment and prescription to the patient, and whether the patient may have risks, is determined through this test. This test is most important in seeking balance in the body, and testing of the whole body is possible. Well then, aren't there any preventative measures to be taken prior to paralysis?
중풍의 전조증이라는 것은 중풍이 오기 전 단계입니다. 전조증이 있는 사람이 바로 중풍이 오는 경우가 있고 이미 무증상성으로 뇌졸중이 와 있는 경우에 오는 경우가 있고 그 다음에 이제 중풍이 바로 이제 진행되는 과정에도 전조증이 나타날 수 있기 때문에 전조증의 증상은 주로 뭐 눈이 둘러 겹쳐 보인다든지 초점이 안 맞다든지 그 다음에 이제 머리가 어지럽다든지 귀에 소리가 난다든지 말하는 게 좀 이렇게 어둔하고 좀 어렵다든지 그 다음에 팔 좌우측 팔다리가 저리거나 힘이 빠진다든지 그 다음에 걸음을 걸으면 중심이 흔들린다든지 그 다음에 이유 없이 두통이 좀 계속된다든지 이런 경우죠. 그런 경우는 바로 이제 예방검진을 빨리 함으로 인해서 원인을 찾을 수 있습니다.
Although collapse may occur suddenly, it is not something that happens out of the blue. 61-year-old Mrs. Nam. She has been suffering from high blood pressure and diabetes for over 7 or 8 years. It was common for her to experience cramps in her legs and on the head. Having lived in a considerable routine, maintaining her health, she collapsed suddenly early in the morning. In her case, although her high blood pressure and diabetes are the cause, her high stress at that time was the main factor of the onset of the disease. Fortunately, having been treated at the hospital early, her pulse had returned to normal and the paralysis symptoms have recovered considerably. For this result, taking the treatment step by step was essential.
중풍의 치료는 보통 두 단계로 나누어 볼 수 있습니다. 초기 발작 단계, 즉 인사불성 등 지각이 상실되고 계속적으로 어떤 증상이 악화되는 단계가 있고 두 번째로 어느 정도 그 상태가 끝난 다음에 후유증으로 고아나사라든지 두통, 반신불수 등이 나타나는 단계입니다. 초기 치료는 일반적으로 기혈이 막힌 것을 뚫어서 우선 생명 자체를 안정시켜야 됩니다. 보통 사지말단을 출혈시켜서 기혈을 소통시키는 것과 약을 쓰는 방법이 있습니다. 그리고 중간 관리 단계는 이 중풍 바람을 일으켰던 원인인 화를 가라앉히기 위해서 음기를 보하는 방법으로 약을 쓰는 것이 보통이고 그 다음에는 음식 조절, 생활의 조절 등이 있습니다.
From the past, treatment involved acupuncture, moxibustion, and medicine. Acupuncture was the first priority. For paralysis, there are 7 main acupuncture points. Pek He on the vertex. Poke Pin on the temples. Hokji on the arm. Hyupgok on the hand. Pungshi on thighs and Samni on legs. And Hyunjong are the main acupuncture points. Applying acupuncture to these points enables the flow of vital energy and blood to be improved. In the Korean traditional medical field, research is currently being carried out actively on how acupuncture is effective in treating paralysis, especially the Gokji and Hyupgok points. Applying acupuncture to these points stimulates the brain through the meridian. There is a report that acupuncture is effective when it is applied to the points to stimulate the blocked cerebrovascular area. When acupuncture is applied to the patient with a blocked cerebrovascular, a change as a consequence can be witnessed through the brain photo. The second important treatment is moxibustion. It enhances the circulation of vital energy and blood when there is a disorder from paralysis by heat stimulation. It is usually applied to the abdomen. This is an important enough point to have been recorded. Longevity can be increased if moxibustion is applied frequently to this point. The name jumbo moxibustion was given to this particular treatment as it is large, removes the poison accumulated especially in the body, and clears the blood. Heat is brought by burning dried mugwort. Not only the heat, but its scent also stimulates the brain cells. Together with the mugwort effect, moxibustion is effective for nerve disorders. Korean traditional herbal medicine balances the internal body that had been broken down by paralysis and strengthens the circulation of vital energy throughout the body. A variety of dried roots are used to remove phlegm and strengthen vital energy. They are wild herbs used as medicinal supplements. Some help to recoup from the symptoms of paralysis or cramps, and others are key life-saving materials. In Korea, tablets known as Uhwang Chongshim-1 were given to those that suffered from sudden collapse due to paralysis. Being made of over 20 types of herbal materials, this medicine is known to be effective in treating paralysis as well as heart disease. A test was carried out to check for its effect. By observing what change this medicine brings on cerebrovascular flow, we should be able to determine its effect on paralysis. A healthy man in his 20s was put on cerebrovascular flow measurement equipment and was tested before taking the medicine. He was then given one Uhwang Chongshim-1 tablet. A reaction was observed for an hour. What changes did this bring about to the cerebrovascular flow? The change is indicated by the tilting of waves. Those with high slants indicate a great increase of blood flow after the ingestion of the tablet. The tablet therefore expanded the once contracted blood vessels.
중심화는 뇌경색 또는 이제 뇌출혈, 특히 뇌경색 환자에 대해서 혈류 개선 효과가 있습니다. 혈류 개선 효과가 있고 또 실험적으로 우리가 중풍 모델, 예를 들어서 이제 혈관을 이제 막아서 경색 모델을 만들어서 그 경색 모델의 어떤 실험 동물한테 정신만을 투여를 하고 이제 뇌경색 모델에서 경색이 이제 진행된 정도를 봤을 때 정신만이 뇌경색이 진행되는 것을 억제하는 그런 효과가 지금 우리가 보고되고 있습니다. 그리고 또 한 가지로는 이제 지연성 뇌허혈을 정신만이 억제하는 효과, 아까 실험 동물에서 말씀드린 효과, 그 두 가지가 중풍에서는 정신만의 주요한 기전이라고 볼 수 있겠습니다.
Although life can be saved, paralysis is a serious disease where patients can suffer permanently after its onset. It is predicted that over 15 million people have been disabled through paralysis throughout the world. Once the dangerous part is over, enough to move, recovery treatment must be taken. The recovery treatment helps to relieve the paralysis of arms and legs through the brain damage and also recoup muscle. During the program, acupuncture, moxibustion, and medicine are used simultaneously to treat the damaged brain, which is the main cause of paralysis.
그 전에 저도 중풍 걸려서 다리 쩔뚝쩔뚝하는 사람 보면은 그저 조금 불편한 정도인가 보다 그렇게 생각을 했는데 이 병을 딱 걸리고 보니까 이보다 더 무서운 병이 없어요. 그때는 꼼짝을 못했어요. 아주 이 다리 하나도 못 떼어놓고 꼼짝을 못했어요. 침대에서 대소변을 다 받아내고 또 식사도 침대에서 누운 채로 하고 그랬으니까요. 그러니까 지금 화장실 출입을 조금만 도와주면 하고 식사도 내가 다 하고 그러니까는 많이 좋아진 거죠. 그때다 비하면은.
For those people wishing for a healthy elderly life, their main concern is paralysis. It is a serious disease that causes problems both mentally and physically due to problems in the brain, which controls all functions and movements of the body. Korean traditional medicine has long been carrying out research into paralysis treatment. And through this accumulated experience, Korean traditional medicine has been respected for its treatment of this terrible disease. As it was in the past, paralysis still remains the greatest incurable disease. Once it attacks, normal movement either becomes impossible or death may ensue. Finger pressure therapy is one way to prevent it, and there are 7 blood points. There is a point called Paekwae, which is located on the vertex where hundreds of vital energies intersect. Pressing this spot or patting it lightly will expose the heat externally and regulate the blood circulation in the brain. The Kokbin point, on the other hand, helps the flow of vital energy and removes body heat and air. Similarly, stimulating the Kyeongjong point using a pen or nail can prevent symptoms of paralysis and arm cramps. This is located going above the nipple, where the neck meets the shoulder. Gokji is also an effective pressure point for cramped arms or coldness by circulating the vital energy and blood. This is the oval spot above the elbow when you bend it. However, Pungshi is where 4 vital points are gathered, where the middle finger reaches when you straighten your arm, standing straight. This is most effective for cramped legs or irregular circulation of blood. Choksamni is the most important point for all diseases. It is located approximately the width of 3 fingers above the knee. Pressing here helps the circulation of blood and regeneration. There is also the Yanggu point, located right in the center of the ankles, going about 4 knuckles above. Stimulating or massaging this point strongly can relieve numbness in the legs or pain. Remember that it is often too late once you contract paralysis. Give yourself some time to rest and try the finger pressure therapy to prevent possible paralysis.